I'm Rebecca Bravo with Dignity Health, and I'm here at Glendale Memorial Hospital with Chief Medical Officer Dr. William Wang. So tell us, Dr. Wang, is it safe to visit Glendale Memorial Hospital for your routine or urgent care needs during the COVID pandemic?
It is absolutely safe to come to the hospital, especially if you are ill or don't feel well and you need to come to an emergency room. You should definitely come to an emergency room. If it's something that you can wait to see your primary care doctor, then you should by all means please go see your primary care doctor. What we've noticed is that patients are sitting around at home waiting for things to get better. They don't get better, and they're coming in much, much sicker, and they don't have to. They can come safely into an emergency room here at Glendale Memorial. They're segregated between the patients that look like they might be COVID versus those patients that don't. And then they come straight into the emergency room, and there's no issues of them trying to get exposed by other patients, because as soon as you come in, every person that comes in has a mask on, and that decreases the chance of transmissibility.
So when it comes to surgery, is it safe to still have surgery during COVID? Are you testing these surgical patients prior to their surgery?
So having surgery, again, this is a discussion that each patient has to have with their surgeon and determine when is the right time to have surgery. If you guys determine as a group that it's time to have surgery, the hospital is ready to take patients.
What precautions are taken when any individual enters the hospital?
So we've limited the entrance points into the hospital. It's the main hospital lobby, and the second place is in the emergency room. Any person coming into the hospital, and that includes staff, patients, vendors, all go through a screening process where we ask them, do they have any current symptoms as guided by the CDC. We also check your temperature to make sure that you don't have a current temperature of more than 100 degrees Fahrenheit. I can show you how that looks like over here.
Sure, let's go take a look.
This is how you enter the hospital, and this is how we practice social distancing. You can see on the floor, there's lines for everywhere 6 feet apart for where you need to wait until you approach the hospital. This is how every person that walks into the hospital gets screened every single time, and they're asked a bunch of questions, which we'll go through right now, and you'll see how it goes. Come with me. Hello.
Hi. Would you please jump?
Yep.
Any symptoms? Would you check the sign there?
Yep.
Do you have any symptoms?
Nope.
Let me check your temperature,
Okay.
please. 96.6.
Okay.
Which is good.
What would happen if I had a temperature?
Or you have to go home and stay at home when in quarantine.
Okay. And we give patients information about that?
Or should we have this, okay, so you can really take it home.
Thank you so much.